Joining us now is the president of Liberia, Ellen Johnson Sirleaf. Madam President, thank you so much for joining us. First, do you have an update on the 2 Americans battling Ebola in your country?
We understand they are still under treatment. They still have not yet been cured of the disease, but they're being treated very well and being given the fullest of attention.
Madam President, you've told the Ministry of Health in your country to consider burning the bodies of those who have been killed by Ebola. You also ordered Liberia's borders closed. Have those measures done anything, do you think, to curb this horrible outbreak?
Stopping the movement across borders have had a little effect. We still need more enforcement of it. The order we gave to close schools and to do other things are ones that we are still in a business of trying to enforce it. This is serious. It's a strange disease. Our people know nothing. There's no cure. There was denial. It's now turned into fear and panic. And therefore, even controlling borders and controlling places where we put quarantine is difficult because of the free movements to which our people are accustomed. This is a very, very serious, it's very nearing a catastrophe.
Do you think the people of Liberia understand how grave this threat is?
No, they don't, and that has been a problem. But that information is now getting through. As I said, there was quite a bit of denial. People did not respect the health authorities' advice. They thought this was just a scam, but now they are seeing people die. People are dying in their communities. There are dead bodies all over the place, and they now know that it's real. They know that it's deadly, and they are now beginning to respond. Unfortunately, they now are fearful, and they are beginning to panic. They are beginning to run from one place to the other for safety, and that's our challenge, is to be able to contain them, to make sure we keep them in the places where they can be quarantined, we can identify, we can trace people with whom they've interacted so that we can stop the spread of this disease.
Our thoughts.
And please let me. Yes, go ahead.
Our thoughts and prayers are with your country, but of course you need more than thoughts and prayers. The U.S. today announced it's flooding the affected areas with new healthcare workers. Tell the world what you need to help stop this epidemic, to help stop what's going on in Liberia.
Let me first say that this is not a Liberia problem or Sierra Leone problem or Guinea problem. It is an international problem. What we need is to build our capacity in terms of technical assistance for training, technical assistance for treatment in the form of doctors and nurses, those who have expertise in this area, perhaps having served in Uganda or in the Democratic Republic of Congo. If we can mobilize them, the Center for Disease Control have people here. We are grateful for that, but it's not enough because they are stretched thin. They need to have additional support. Logistics, the supplies, preventive material to be able, prevention, the things like chlorine and those things that will keep people safe, that will improve hygiene. The basic things are all needed. Liberia has tried. We've used our own resources, but obviously we have limitations in our own resources, and we hope that we'll see the international community see this as a grave international disease and international catastrophe, and will respond to it in like kind.
And President Sirleaf, lastly, if you would, what's your response to the Centers for Disease Control and Prevention here in the United States raising the travel alert to your country to a level 3, basically suggesting that no one go to Liberia unless it's essential travel?
I think that's an acceptable preventive measure. We have not reached a place of any international threat, but any measure that will prevent people, that will limit movements until we can contain this problem is welcome, and we welcome the partnership with the Center for Disease Control that we now have, and we will work with them to ensure that while this advisory is respected, that they become comfortable, that we've taken enough measures at our exit points, including our airports, to prevent people and to contain this. The Médecins Sans Frontières is working with us. Maritime Press is working with us. We are all in the same accord on trying to prevent and contain, even as we try to respond to those that require treatment.
Liberian President Ellen Johnson Sirleaf, thank you so much for your time and best of luck.